Good morning. I like to reward the prompt. I really am so thrilled to see this level of interest and involvement. And just to kind of get started on a soft start here, because like I said, I reward the prompt. I'm Senator Karen Keiser, Chair of the Senate Health and Long-Term Care Committee. We'll have other members joining us, but right now we have Representative Joe. Yep. Go ahead, introduce yourself.
I'm Joe Schmick, represent the 9th District. I'm ranking on the Healthcare Committee in the House.
And on our Joint Select Committee as well. So we're just going to do a really quick round robin of people at the table here. I have asked that anybody who is a participant in this process of discussion we've had over the last several months to sit at the table, and staff mostly to sit, or professionals who are here all the time to sit in the back of the room, just because of space considerations. So I'd like to just do a quick round robin, just name, rank, and who you're representing as we go around. And we'll start with Tim right here on my left.
Tim Layton with the Washington State Medical Association.
Hi, Dr. Nick Ryasich. I'm current president of WSMA.
Hi, good morning. T. Hobenick. I'm president-elect for Washington Academy of Physician Assistants.
Misha Werschkel, SEIU Healthcare 775 Northwest.
Molly Belozerfirth, Director of Public Policy, Community Health Plan, Community Health Network of Washington.
Ellie Menzies, SEIU Healthcare 1199 Northwest.
Cassie Sauer, Washington State Hospital Association.
Susie Tracy, Washington State Medical Association, Ambulatory Surgery Centers, and others.
Lisa Thatcher, Washington State Hospital Association.
I'm DJ Wilson with, I'm a public policy consultant to a handful of providers plans.
Scott Sigmund, Leading Age Washington and the Washington State Association of Nutrition and Dietetics.
Chris Banderley, Regents Blue Shield.
Mary Clogston, Washington Academy of Family Physicians.
Paul Barron, Regents Blue Shield.
Len Soren, Primera Blue Cross.
Matthew Kennedy, AWB.
Adam Geiger, Governmental Affairs, Washington Association of Naturopathic Physicians.
Robert May, Washington Association of Naturopathic Physicians.
Rich Maturi, Primera Blue Cross.
Oh, sorry. I didn't know if he had gone yet.
Next
Lori
table.
Lippold, Washington Chapter, American Academy of Pediatrics.
Dave Knudsen, United Healthcare, Washington Healthcare Association, and the Osteopathic Medical Association.
Laurel Lee, Molina Healthcare.
Scott Platt, Group Health Cooperative.
Tim Lehner, Washington Healthcare Association, past chair.
Joe King, Group Health Cooperative and Washington Healthcare Association.
Lonnie Johns Brown, Washington State Society for Clinical Social Work and others.
Sophia Aragon, Washington State Nurses Association.
Leslie Emmerich, Home Care Association of Washington, Washington State Hospice and Palliative Care, and Association of Advanced Practice Psychiatric Nurses.
Rich Miller, Washington Healthcare Association.
Claire Spade-Remy, Multicare Health System.
Andrea Toll, also with Multicare. Lisa Plymate, Doctors for America and the American College of Physicians.
Mary Looker, Washington Association Community Migrant Health Centers.
Mary McWilliams, Puget Sound Health Alliance.
Jackie Dury, UW Medicine, including Harborview and UWMC. And
Susie Dade, Puget Sound Health Alliance.
Chris Free, Washington Association of Health Underwriters.
Fred Brown, the Executive Director of the Healthcare Cost Management Corporation, a group of 36 Taft-Hartley trust funds primarily in Washington and Alaska.
Great. Excellent. And Senator Frocht, would you like to introduce yourself very quickly?
Senator David Frocht, 46th District.
Excellent. This is a terrific table of healthcare experts, healthcare advocates, healthcare professionals. And I hope that everyone has signed in. We have sign-in sheets in the back because this discussion is not going to be over soon. This is a long-running discussion that we're having. I first want to introduce my fantastic healthcare staff. And the newest member is our new Healthcare Caucus staff person. Many of you know her from other committees. Her name is Sydney Forrester. Sydney, would you stand up so people can get a face and a name together? Sydney is expert and learning healthcare policy now, but she's been around the legislature and in caucus positions for years. I worked with her in the House when I was on the Education Committee. That was a long time ago. Also, we have, of course, our I guess I'll have to call him a part-time member, but he's going to share duties with the Human Resources Committee, Kevin Black, if you'd stand up. And, of course, all of you know Kathy Buckley and Michelle Needham are are tandem professional staff experts. So as you know, this is an ongoing discussion, so it's not something that is going to end today, and stay in touch with staff and with my office as well. We've had several interim meetings since I think we started last July for our first payment reform meeting, and we've had several since then. We divided them up so that they were sort of in distinct cohorts of groups, long-term care and hospitals and insurance plans and so forth, advocates. Today we're at the big table. Everybody's here. We all have different perspectives, and we all have different attitudes about things and concerns about issues. The ones I want to focus on as we're working through this is on some things that have floated to the top as we work on health care access and reform, and that includes cost and accountability and transparency and quality. Those are the lodestars for us. We all share, every one of us in this room and every one of us at the table, we all share that we are committed to the best possible quality health care that we can get for Washingtonians. I know we all share the values of high quality, low cost health care at the sort of the sweet spot of reaching. But we have to create a method of agreement. We have to create a method of going forward. And I think the method we create is a method of shared goals, shared values, and shared savings. Because as we improve our care, our quality of care, our coordination of care, our information about care, we will realize savings. And we need to capture those savings, and then we need to share the savings. It isn't fair just to reduce ER use in the sense that if the current system is based on different usage-based levels and different reimbursement levels, if we just cut one piece of the pie, other pieces don't grow. So what we're trying to get to is not a consensus. I don't think we'll get to unanimity, but to an agreement that we can go forward on our shared values, our shared goals, and our shared savings. We're taking ideas from the last 5 or 6 meetings that we've had as cohort groups and from other states. And I've synthesized them into a list of bullets. And I don't know if the bullets are out yet, but these are just a list of potential ways to go and explore the next few years. This isn't a one-time silver bullet approach. This is a multi-level look at improving transparency, focusing on cost containment, improving incentives for chronic care management, and focusing on evidence-based and quality of life issues. So it's comprehensive, it's high level. There aren't any details in these bullets, but it gives you a sense of how I see it as we can go together and go forward in agreement on some topics. I don't want to walk through all of the bullets at this point. I would like to just share a few pieces of information that might be somewhat enlightening. Well, maybe not. Maybe you all know this already. I just want to share a story about an ER visit in multicare. And we've got copies of this one. It's just one of the things that happens. And multicare is not being picked on. It's just one of the things that happens in our system. So a person I know knows a person who had a terrible pain in the middle of the night. There wasn't any way to stop it, and there wasn't any way to solve it, and so she ended up in an ER room in multicare, the multicare system. And she was there for about 6 hours, mostly under observation. The CT scan was done. And nothing, she was sent home with Prilosec. And she got the bill a few weeks later, and you're getting a copy of it. And that's the level of detail that was in the bill, and that's the amount. As you can see, it's $14,000 for 6 hours of observation. CT scan was charged separately. Emergency physician was charged separately. This woman has health insurance. She works part-time at a retail store. Her health insurance will cover $500 of it. So this is how come medical bills are still the #1 reason we have medical bankruptcies, as the #1 reason for personal bankruptcies. And we have got to keep that in mind as we work through these issues of cost and transparency and accountability and quality. I would also like to put forward some new information that we're getting. I think this is through Keiser, about an attempt by purchasers to force a little more transparency and accountability. I think it's called the Catalyst Report. It's a combination of employers and unions and Taft-Hartleys who are basically making negotiated deals for bundling certain procedures to be done. In our area, we've seen Walmart has now worked with Virginia Mason to bundle some kinds of services for their employees. Boeing has made a deal with the Cleveland Clinic for employees to go all the way to Cleveland, and they'll pay the airfare and so forth. These kinds of efforts are also underway. Employers and purchasers are beginning to push hard for more accountability and transparency. And I'll remind you, of course, that the state is a large purchaser. And then last but certainly not least, I have to compliment the Hospital Association for their response to my concern about transparency. And the Hospital Association has put a lot of information on their websites, and there are many different levels of information. But one is hospital pricing information. The website is available, it's online, it's got basic information about different procedures. It's a start, and I do have to compliment the effort there, because we, before now, have had virtually nothing. So we're making progress. That's an important piece. And then on the a sort of larger level, the Puget Sound Health Alliance has also put together incredible amounts of information and data, the community checklist and all the other levels of metrics that are being put together. And the partners at the Puget Sound Health Alliance, in many cases, are purchasers. So those are some of the big pieces of the furniture that we have looked at so far. And at this point, I do want to focus a little bit on what the Puget Sound Health Alliance has proposed on transparency, on concepts, and on barriers to where they've gone.